Welcome to the first episode of 2021 Vision. My name is Nima.
And my name is Selena.
2021 Vision is a series of episodes featuring 3 healthcare professionals per episode. Through these episodes, we'll be showcasing how we will use what we learned in 2020 to advance the healthcare professions and bring optimal health to others in 2021. We aim to provide you with insight from trusted caregivers all around the nation. 2020 has motivated us to inspire you to appreciate the present, challenge you to cultivate your future, and motivate you to make a difference in the healthcare world. On the first episode, we are joined by Dr. Wael Barsoum, Dr. Patricia Brennan, and Mr. John Armistead. Dr. Wael Barsoum is a practicing orthopedic surgeon. He received his Doctor of Medicine degree from the Ohio State University College of Medicine, and he completed a residency at the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University. Dr. Barsoum is currently the President and Chief Transformation Officer at Healthcare Outcomes Performance. He is the immediate past CEO and President of Cleveland Clinic, Florida. During his time there, Dr. Barsoum cultivated and transformed Cleveland Clinic, Florida, from a $600 million single 155-bed hospital system with 9 remote sites to a $1.8 billion 5-hospital, 1,083-bed care hospital system with over 40 regional sites.
Dr. Patricia Brennan is the Director of the National Library of Medicine, one of the 27 institutes and centers of the NIH. She received her Master of Science in Nursing at the University of Pennsylvania and also received her PhD in Industrial Engineering from the University of Wisconsin-Madison. Dr. Brennan has developed ComputerLink, an electronic network designed to reduce isolation and improve self-care among home care patients. She directed HeartCare, a web-based tailored information and communication service that helps home-dwelling cardiac patients recover faster and with fewer symptoms. And lastly, she directed Project Health Design, an initiative designed to stimulate the next generation of personal health records. Our last healthcare professional joining us today is Mr. John Armistead. He is the System Director of Pharmacy Services at Lee Memorial Health System in Fort Myers and Cape Coral, Florida. He oversees more than 290 pharmacy staff members. Mr. Armistead obtained his Master of Science in Hospital Pharmacy at Ohio State University and completed a pharmacy residency at Riverside Methodist Hospital. He previously served as president of the Kentucky Society of Health System Pharmacists and Ohio Society of Health System Pharmacists. He was the 2004 KSHP Pharmacist of the Year. Mr. Armistead is also the past president of the American Society of Health System Pharmacists. We hope you guys enjoy the insight that these 3 healthcare professionals brought to our first episode. Obviously, COVID has had a huge impact on all of us, and it's affected us all in many different ways. What's the first thing that comes to your mind when you hear 2020?
I think the first thing I would say is probably tragedy, right? I mean, here in the United States, we've lost so many incredible people. Many of us have friends, family members, or have a friend who lost a family member. And that tragedy is going to live with all of us, I think, for the rest of our lives. And when you look back, the last time we had a pandemic of this magnitude was the Spanish flu. It was over 100 years ago. And that tragedy can never be overstated, to have lost so many loved ones and so many members of society. So I think that's, sadly, that's what stands out the most. But, in times of sadness, we always find rays of hope. And I think that as a country, we found rays of hope throughout this year of people doing great kindnesses towards one another. I mean, even something as simple as masking in public, you're protecting somebody else. And that alone is an act of kindness and is really a responsibility for each one of us. So we have found some rays of sunshine throughout all of this, coming up with immunizations within a year. I mean, you guys as leaders in the pharmacy world recognize what an amazing feat that was, to actually come out with usable, safe vaccines within months of the very first patients contracting this virus, and within I think it was within 3 weeks of recognizing the genetic code of COVID-19. That's amazing. I mean, to understand how much our pharmaceutical world has moved forward in such a quick amount of time is really impressive. So certainly a year of tragedy, but rays of sunshine throughout that.
What has happened in the two professions that I most closely align with, which is I'm a nurse and I'm also an industrial engineer, but I think of myself, my specialization in medical informatics. So we have been called on as professions to operate under very different structures, very different time horizons, to deal with rapid learning cycles and different kinds of information flows. So what I see, and I have a great, I'm incredibly proud of the professions, is this resilience, stepping up to an incredibly complex set of demands over the year.
Well, I guess the personal things are probably what hits you the most, and it's the interaction with other individuals or family members, or not being able to visit family members. So I have family in Virginia as well as Hawaii right now, and as well as Kentucky, and missing that normal travel that you're allowed to see family. So that's the first thing. In regards to business and professional society work, not being able to travel around nationally has been an issue. So certainly my wife and I, she joined me as a pharmacist, and we've been traveling to every ASHP mid-year clinical meeting since 1981. So this year having a virtual meeting, missing out on New Orleans and the wonderful things that New Orleans has got to offer, quite dramatic for us. But you know, it's been a quite tumultuous year in regards to the health care of American citizens, and that's quite dramatic in regards to what types of procedures we had to implement, the morbidity and mortality associated with the pandemic has been extraordinary, and it's been something that really has touched so many factors of our lives. And not only adults, it's children. Not seeing my grandchildren as I would love to do has been a dramatic effect on our lives. I appreciate the audio video types of things that you're able to do to still maintain connection. Yep. But the personal interactions with the other individuals have really been dampened and kind of curtailed to a certain extent.
So at the beginning of COVID, you were CEO of Cleveland Clinic, and now you're currently the president of Healthcare Outcomes Performance, and you're also a practicing physician. So you wear many hats in the healthcare world. How did 2020 impact your profession, and how will it be changing moving into 2021?
Yeah, I think that's a good question, Nima. So, while I was CEO of the Cleveland Clinic, we were in active planning starting in March for a massive surge in patients. And we were prepared to more than double our hospital beds, to triple or even quadruple our intensive care unit capacity. We had doctors such as myself as an orthopedic surgeon trained up and ready to go to kind of manage ventilators. So that was clearly a change. I mean, when I think about the practice of healthcare, watching people really prepare themselves to be at true top of licensure was amazing. So general surgeons that were going to manage intensive care units, anesthesiologists who were going to leave the operating room to manage ventilators in the ICU, surgeons such as myself, that would take responsibility for a small number of patients on ventilators that would then be reporting to others that had more experience with ventilator settings. The ability of our healthcare system to turn a massive ship on a dime to take care of what was expected to be so many critical care level patients was really nothing short of amazing. So that was clearly something that we learned as a healthcare system and as a country. I think, the tragedy that we all saw unfold in New York today would hopefully not unfold, because we've learned so much from this past year that we would, I think, react differently. We would get more folks, more equipment, more supplies into an area like that more quickly than we had in the past. So I do think that was clearly a big change. The second big change that we saw is the secondary effects of a pandemic in terms of delayed care for others. So at the Cleveland Clinic, for example, we saw significant decreases in the number of patients that presented with chest pain, heart attacks, strokes to our emergency department. The reality of it is, I think all of us would agree that the number of strokes didn't decrease during that time. Just people were afraid to seek care. So how we prepare our physical plants to continue to function in a time of a very contagious virus like coronavirus, so that patients continue to feel confident in the safety of the environment of the hospital, was something that we learned a lot about. So setting up triage tents, for example, outside of the hospital before people stepped in to try to minimize the risk of introducing, virus particles into the air systems, for example. That was a great step forward. And educating folks that they ought to come in. I remember in the month of April, if I remember correctly, 50% fewer cancers were diagnosed at the Cleveland Clinic than 1 year before. So again, that means that there were women at home that felt a lump in their breast but said, I'm going to wait to go in. There were men at home that were doing self-exams that felt a lump, and said, well, I'm going to wait. And that's clearly an issue, right? Somebody starts coughing and it's maybe a sign of lung cancer, but they're afraid to go to the doctor. So I do think that this year has been a year where we've really reintroduced the trust factor on a much larger scale. And the last thing I would say that I believe has changed, and I'm sure we'll touch on telehealth and things like that later, but the last thing that I think has changed for the better is a renewed respect and appreciation for caregivers. So, those that and frontline workers. So those that put their lives on the line every day, whether you're a doctor, whether you're a pharmacist, whether you're a policeman, whether you're a fireman, or a postal worker that delivered the mail every day, right? Somebody that works in a food kitchen preparing food for the homeless. Every one of those folks showed up to work every day committed because they knew that somebody else needed them. And I think that the rest of the world has recognized that deep commitment that caregivers and folks like that really have towards their fellow man. And I think that's impressive.
From the profession of nursing, clearly around the world, nurses have been frontline, front-facing, patient-engaged participants in the process of treating people, helping to prevent or respond to the illness that it was not well understood, not well defined, and the pathway to know the cues that we were treating patients properly were not the usual cues. So there was a tremendous challenge and a drain on the profession, worried about personal health, worried about being able to effectively treat individuals. The engineering, the systems engineering or industrial engineering base that I have that brings me to think about health information, frankly, left us with some egg on our face. We have information systems that are not built for pandemics. We have information systems that were built around the business structure of a healthcare delivery system, and not the cross-sector needs that we had to understand public health and personal care at the very same time. So I think to my professional identity within medical informatics, we have a huge wake-up call about the need to have wide, free-flowing, but protected information crossing a lot of health sites. Now, my job is to direct the National Library of Medicine, and we provide 24/7 access to massive literature databases through PubMed, full text articles through PubMed Central for professionals, and through Medline Plus for lay people, and also enormous genomic data banks, both human and non-human data banks. And so we have to be available. And yet, like everywhere else in the world, the pandemic required that we move to a complete telework environment. So the 1,700 women and men that support the National Library of Medicine are now working from homes all over the country. So we needed to find a way to ensure the ability to deliver our resources without interruption, because our data banks are used automatically more so by computer systems than by humans. although altogether they're used 5 million times a day. So we have this constant demand, and yet we couldn't be in the place. So we have a very small workforce on campus at NIH, making sure our computer data banks are working properly. We have a much larger workforce distributed around the country. And I have to say, I'm very proud of the fact that we haven't missed a beat. We haven't had any unplanned downtime. Our resources have been available. And yet we've had to come up with some new resources because the pandemic helped us realize that rapid circulation of knowledge was essential to being able to have an effective response. Does hydrochloroquine work or not work? How do we get information to the hands of individuals who need to know what is the most current therapeutic? Monoclonal antibodies, yes or no? Lots of complicated questions. And the literature is slow. The literature, doing a paper, conducting a study, writing the paper, getting it reviewed, takes a long series of time. It can take, even under the best of circumstances, and we saw some evidence of this year, it can take months between a study being completed and the paper being reported in the New England Journal, as we saw with one of our early studies for remdesivir. So the National Library of Medicine began in June, index preprints, make preprints available to the public, discoverable in PubMed Central. This was the first time we had a merger of the formal literature and the preprint literature. And we conducted this experiment in part because of the need to figure out how to get fast turnaround of our research results. So beginning in June, we started to index any preprint associated with an NIH-funded study that had been deposited in a recognized preprint server, like bioRxives or medRxives. So the changes we had to do while totally evacuating our building is bringing new kinds of information resources, making them available and discoverable to the world at large.
At Lee Health, our guide is to optimize patient outcomes through interdisciplinary medication management. It's only 7 words, but those 7 words need to guide every one of our pharmacy staff members and really think about what can they do in regards to furthering that mission. So breaking it down, I know and I said the words already, but really to optimize patient outcomes, to do the best that we can for an individual patient. That's really critical, to think about a one-on-one relationship as your healthcare professional to the patient. And what can we do to optimize their outcomes? Whether it's a newborn or whether it's an adult or whether it's a hospice patient, we should always be thinking about what can we do to aid that person through medication to aid in their processes. I think another key for pharmacists to remember is to think and emphasize the interdisciplinary aspect of their care delivery in all aspects. Even it's communicating what you do. If you did it by yourself as a pharmacist, you need to have the interdisciplinary flavor of interacting with other professions to do the best for that patient. And our expertise in the healthcare environment is really medication management. It's the thought of how do we apply one of many drugs that are on the market. And there's over 80,000 drugs that are on the US market in different dosages and forms. But how do we take that drug specifically for that patient and really improve their outcomes? Medication management involves, the whole process of prescribing it and making sure it's selected correctly for that patient. Then it's the right dose, the right time, the right frequency, the right administration route. And then we need to think of how do we appropriately monitor that to make sure that we're getting the outcomes in those patients. Another key that I think that guides us in our process and as a pharmacist, and I've been thinking about this for quite some time, is we need to take generalized information that we learn in pharmacy practice from the literature, from the resources that we have, from the databases that we've had. So take generalized information and make it specific for that patient. It's got to be the right thing for that individual. So take generalized information, make it specific. The other thing we need to do is we need to really guide our patients towards the right outcomes for that individual.
So last year taught all of us many different things, whether it be like learning from our mistakes or bettering ourselves as professionals. From your personal experiences in 2020, what do you think the focus of 2021 should be?
So I think a few things. I touched on the fact that we clearly had some lessons learned throughout this pandemic. We need to take those lessons and learn how to apply them so that we're never taken off guard again.
Yeah.
I think that that's an important point. So how do you set up triage tents? How are you set up to surge up for demand if you do have, whether it's on a national level or a regional level or even a local level, a surge in pulmonary disease, something like that. So how do we take some of those lessons and apply them into a playbook that God forbid, if this happens again, you pull out that playbook and you say, all right, here's step 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, all the way to step 2036 to ensure that we're prepared and we can surge up for that. That's number one. Number two, I think showing gratitude to caregivers, first responders early, recognizing the sacrifice that they're making. I mean, I remember, coming home every day, taking my clothes off in the garage, jumping right in the shower, recognizing that every day, not only are you putting yourself at risk, but potentially you're putting your family at risk. So how do you come up with a plan when you get home to ensure that you're minimizing the risk to your family? I think that's also important. I think the other thing that it taught us, and I'm not trying to say this in a politically calculated way, is the importance of a nationally directed response to something like this. Having clear leadership that's data driven and telling us exactly what's going on and what to expect is extraordinarily important. I think we would all agree that Dr. Fauci has been an incredible advocate for patients, for the healthcare system, and has really been a voice of reason throughout this whole pandemic. But again, on the national level, we clearly needed real direction and real focus, and that's something that I think we have to be prepared for in the future. You can't ever bury your head in the sand when it comes to healthcare. It'll come back and bite you. That's just the reality. I remember as a resident looking at a knee replacement that had been done a few weeks before at an outside hospital, and it came in, and the patient saw one of our doctors at the Cleveland Clinic in Cleveland when I was training there, and the wound was red and it looked like it was likely infected. And the doctor said, never bury your head in the sand. If this looks like it's infected, you are now obligated to treat it as an infection and rule out the infection, because every minute that you delay, every hour that you wait, every day that goes by lessens the likelihood that we're going to be able to clear this infection and retain the implant. And that piece of advice from him has really lived very strongly with me. And if you look at this pandemic, I think it's a pretty good example that you have to react, and you have to react in a very forceful and directive way right away. And I think that makes a big difference.
We have learned ever so much through this pandemic that open access to data, whether it be information about an individual to better understand her health practices or information about massive genomic data banks, has got to become much more open and what we would say democratized. So we see the open science initiatives of the United States and open data initiatives, which are being strongly reinforced by our current Office of Science Technology Policy, as being critical for the future. While we recognize the importance of the intellectual property that goes into a discovery made by a research team, when we want to support that research team's right to that intellectual property, under a public health emergency, we have to support the openness of the data so we can determine when we're starting to see the South African variant move into a community, or we're starting to see a rise in a mutation that we hadn't seen before. So open data and open science, to me, will be what 2020 contributes to the legacy that we start building in 2021.
We separate years as humans and to celebrate a new year, but actually it's a continual process. It's a continuum, and life is a continuum. Your practice is a continuum. I think one of the basic things that you need to do is have a guiding direction that comes from a philosophy. And that philosophy is really critical. I think each pharmacist should have a personal philosophy and write it down.
Yeah.
They should also have a professional philosophy and write it down. So mine includes that OPOTIM to make sure that I'm optimizing patient outcomes from my perspective. I think also alignment with the organization that you're in is really important. In ours, some of the key things that we concentrate are, first of all, can we provide an exceptional experience for the patient? To really have them view you as the care that they needed. Because every time there's a care delivery issue, the patient has thought, I'm sick, I need to seek health care. We need to provide an exceptional experience by which that individual has got their problem resolved or addressed. So really, providing the right culture for that exceptional experience is key. The next thing we need to do is we need to deliver on that and provide the right outcome for that individual. So we've got to apply the right treatment that includes monitoring to assure that we're moving them towards the health care and the medical status that they desire and they're able to get to. That's once again optimizing that patient's outcome. So I think it's, not only getting the right culture of really receiving that patient, but the right care delivery to that patient. Then it goes back to that process of that interdisciplinary care. So we really need to coordinate our efforts. I know a lot of healthcare professionals that really think they're doing a great job, and they are, but I do think they need to work harder on the interdisciplinary aspect of their care to make sure other things are put together for the purpose of improving that patient's outcome. Then another thing that's more and more important in the healthcare environment is we've got to make sure that our organization remains financially viable. So we need to have a financial perspective that guides our processes and makes sure that we're providing the right therapies for those patients in the tune of being financially viable and applying our resources appropriately. In that financial analysis, there also needs to be payment for pharmacists in providing care, because we shouldn't be just a product-oriented profession that is really guided by provide a product, we get paid. We are providing healthcare services that really should be provided, and then we need to be compensated for that. So as our profession, we need to be financially viable and make sure that we're able to provide the services we can by being paid for those. But also we have to be careful in how we apply those resources to patients.
If 2020 was a person, looking back, what would be your message to 2020?
You've kicked us, but we're getting back up. So maybe we've been down, but we'll come back, and we'll come back stronger than ever.
You can't get us down. I think it's the resilience that came through, whether it's families, communities providing food, people. I was watching a group of young people in Manhattan doing computer web-based vaccine scheduling for elders. The idea of resilience coming at all different levels of our community. I think the message of 2020 is nice try, but you can't get us down.
I think 2020 was definitely a memorable one and remarkable. I don't think it really guides my future as much as, my planning for the future guides my future. So I really think it's wherever you are, whenever you do it, take your present, and you got to think about the past, but you take your present and then plan your best moves towards the future. I think we do that for people in their roles and their jobs, and that's something that I enjoy doing. Is I enjoy getting into difficult spots because I love the satisfaction of moving and advancing in a positive, optimistic manner that's productive, no matter what situation you're in.
What is your 2021 vision, and how would you say we would reach that optimal health?
So I think it's a few things. I think that my vision for 2021 is to continue to see us as a healthcare system and as a society work hard to improve quality, improve access, and take out cost. Again, I mean, 2020 has been a brutal year. I think 2021, the first 6 months, will be really pretty tough. But again, I think we've seen glimmers of hope in terms of states and organizations that have done a very good job. But I do think that we have great opportunities to take out more cost, improve quality, and make it easier for patients to get high quality healthcare in an easier, lower cost way. So that's my vision, is to continue to kind of drive towards value and hope that we come out with more improvements every year.
Well, because I manage a large workforce, my visions are very much focused on the workforce and the services that we provide. So our outward-facing services, I don't think they're going to look all that different. We're going to have machine and human computer interface to our resources, but our workforce is no longer going to come all the way into Bethesda every day to do their work. They're going to be distributed around the country, and we're going to need to learn how to find the best way to manage to get not only efficiencies from our workers, but innovation and responsiveness to community needs.
More continuity of care, really transitions of care when we have to. But I'd rather look at the route of providing all levels of healthcare services for every single person in Lee County, Florida. And maybe that extends to other places as well. But the key is we've got a continuum of services that we now offer, that we can take care of a patient from birth to death in regards to the care delivery that they need in regards to pharmacy management and medication management. I think we can do that on a collaborative basis with an integrated healthcare system designed really to give that patient a high level of patient outcome. So my vision for that, let's see, more in-home infusion, more self-care. Self-care is really going to be big. I think access points for patients to get information is really going to be key. A virtual visit with pharmacists, they can get one just like they can as easily as you can get. I get golf balls delivered to my house by Amazon the next morning. I think access to your healthcare provider at an instant with quality information by somebody that knows and understands you and that can advance your care is really going to be key. A lot more telemedicine things. I've got more ideas than time to describe them to you, but I think the key is to turn the healthcare delivery system so it benefits the patient, optimize their outcomes through their involvement, their investment.
That concludes the end of episode 1. We would like to thank Dr. Barsoum, Dr. Brennan, and Mr. Armistead for taking the time to join us today, and thank you to everyone that tuned in. Make sure to follow us on our social media at 2021Vision and visit our website, 2020WonVision.com. Until next time, my name is Nima.
And my name is Selena.
And we would like to encourage you to think about your 2021 vision.